Welcome to another episode of Reflect Inquiry, a space for thoughtful conversations about the questions that shape our everyday lives. Today, I'm joined by Dr. Emily Little, researcher, science communicator, founder, and mother whose work explores how culture shapes human development, health, and social systems. For today's reflection, we're thinking about what happens when we try to separate science from culture and healthcare. Emily, thank you so much for joining this conversation.
Thank you for having me. Very excited to be here.
So, to begin, what first brought this question into your thinking?
I went into a developmental psychology program because I was generally interested in prevention and early intervention and understanding how infants learn about the world and come to be competent humans. And through that area of research, I realized how biased our science really is when it comes to what we know about babies and what we know about early learning, what we know about health of parents and babies. And I learned that through experiences, one, just delving into the literature and understanding where the science is actually coming from. You may be familiar with the paper published in 2010 where it called out the whole field of psychology for 96% of research participants being from Western and industrialized, global North countries, giving us a very unrepresentative area of understanding human behavior and human knowledge. So the literature was already starting to call it out. And then I experienced that for myself when doing research internationally outside of the bubble of a developmental psychology, university campus laboratory. So I did research in Vanuatu, in Bolivia, in Guatemala, and very intentionally went in with an open mind and went in to learn from communities, indigenous communities in these countries to further expose the challenge of the biases that we have in developmental psychology, in maternal and infant health, and in our understanding of human behavior more broadly. So, yes, that first experience of conducting research in Vanuatu really blew open this world for me, and I've never looked back. And the more you go down this rabbit hole, the more you realize just how biased our science is, and then how that goes on to shape our healthcare, our family assessment practices, our early intervention practices, and really everything in between, starting with that moment of biased science that is not reflecting human behavior in a representative way.
What was that experience like when you are deep into the work and you realize, wait a minute, this does not fit? How do you change that, or how do you transform your thinking on the spot in a moment like that?
Yeah, there was a particular moment in Vanuatu, which is a fairly remote archipelago group of islands, and is famously studied in anthropology because of its linguistic diversity, because of its lack of integration into Western style schooling. So it's a very culturally unique community to work within and live within. And I remember going in with a fully open mind, but still I come from my own biases and my own identities and my own privileges. And even while going to work alongside these community members and these families, I was interested in questions of early learning, of how do babies play with this toy? How does a mom play with her baby to help their baby learn about a toy? Something that's very, very typical to study in Western developmental psychology. And going there with the intention, again, open, very open, but also with this kind of general idea of what I wanted to study, I realized right away that this was not even the right question. This was not really relevant in these contexts. And that's actually what took me down the path more of studying breastfeeding and lactation and maternal infant health, because you realize right away that sitting with parents and babies and having them play with a toy is such a privileged and kind of weird thing to do in many cultural contexts anyways. And so I immediately felt that, oh, this was a very biased question, even with all of my intentions of going in with an open mind. It was a very biased question. And really what we learn and what I learned from sitting with families and mothers and babies in these in Vanuatu specifically, and then in every community afterwards, was how we had overlooked in Western developmental science the importance of breastfeeding and care and just being with your baby, overlooked that as a core learning mechanism, as a core mechanism for health, and as a core mechanism for caregiving, and how our biases in Western industrialized contexts and our biases from contexts that are hyper fixated on schooling and in particular Western style education, we hyper focus on reading books and learning language and how is this parent teaching their baby. And that has caused us to overlook these very foundational human behaviors, such as offering the breast to the baby, something very simple like this that again, we have overlooked as potentially just food provision or providing nutrition. But really, in my work and just sitting with families, you can see right away that this is very much a deep learning mechanism of how this baby's learning about the world, how they're learning to feel safe, how they're learning about the back and forth of communication and interaction. So it just continued to expose for me how much we have overlooked in Western developmental science, much to the harm of the healthcare practices that we now espouse.
And what do you think we lose when culture is treated as separate from science and healthcare?
Yes. One thing is just we come away with this very biased science. If we ignore culture and we say, well, science is science and this is how we do science, forgetting that we are all humans. And so the way that some humans do science is different than the way other humans do science because of our cultural context. If we forget that, then we end up with a really biased body of science. And then beyond that, we are really operating from a place of a disservice to so many families where one cultural context is now treated as the default because that's what is reflected in our science. It's what is reflected in our healthcare because healthcare is or intends to be based on the science. So then when families and people and whole communities come with practices and beliefs and behaviors that are outside of that quote unquote default, then we can do real harm by not including and honoring and uplifting those practices, or at least trying to understand them. You know, not every cultural practice is a beneficial practice, but we do a disservice to not even taking the time to understand and include and integrate any practice that a family might have. So it's done a lot of disservice to really any family that is coming from outside of this Western bubble of science and healthcare.
If you could re-envision going into a new community and you have these experiences, this literature that you've been exposed to, what might it look like if science and culture were understood as deeply intertwined?
Yeah, well, it should certainly shape how we conduct research, really in partnership with and um, not only in partnership, but really examining who is leading the research, who defines what is research and what is not. And if there's only one group of people defining that, then it's not inclusive, is it? And same with healthcare. If there's only one group defining that, then we're not capturing the full breadth of what it means to provide healthcare as a human. And so, yeah, I think about this in birth equity and perinatal care specifically, where we often see culture and healthcare as these two separate things, where if a parent is going into a hospital to give birth, then it's sort of automatically not integrated with cultural practices that may include warmth for the parent, that may include smells and sights and comfort measures and spiritual practices that's kind of negated by being in the healthcare environment. But it doesn't have to be that way. I really believe that we can have this world where both coexist. And so even if we're working with healthcare practices that are evidence-based, and of course we want that. I am a researcher. I'm advocating for science-based practices. We absolutely want that. And that doesn't mean that we need to get rid of or negate the value of cultural practices that maybe don't yet have the scientific backing, or maybe never will have the scientific backing because it just doesn't work within that framework. But it doesn't mean that both can't coexist, and we can't honor both at the same time, especially in something as foundational and deeply personal and cultural as pregnancy and birth and postpartum.
And you pointed to something that I've been reflecting on also around the phrase evidence based. It brings into question, what do we consider evidence? How do you define that in your practice and in your world?
Yeah, it's really complex because on one hand, we need to have standards and we need to have, a consensus from a professional standard of what gets used and integrated into healthcare versus what does not. But again, one of the biggest problems is that our science is unrepresentative. So it's impossible for us to have a representative base of evidence when our science just isn't there. So that's one big problem. So there's this wonderful movement to push for lived experience and cultural knowledge being treated as evidence. And that's really, really important. And so that's one angle of it, is that we need to honor and understand that a person and an individual's lived experience, as well as a community or culture's experience and identity, is evidence from their perspective, and especially in healthcare. Patient-centered care defines that these aspects of experience are important. But then at the same time, really also pushing for a more inclusive body of research and science so that we can have different forms of evidence. Basically, how can we integrate different ways of knowing about health and care so that there's not only one way or only one format that is considered evidence versus not.
I'm curious how this reflection and this reframing has influenced your own spaces of influence.
Yeah, it was a big part of why I founded Nurturely, the community-based organization that I started right after doing my PhD at UCSD. Was largely in response to these gaps where I saw the massive inequities in maternal health and infant health in the US, specifically racial injustices that are continuing to persist despite having data, knowing how and why we can change these health disparities. Nurturely was started specifically to address that through more representative science and through also honoring community-led work, cultural wisdom. And so that shaped all of the work I did with Nurturely for the past 7, 8 years. And then now working more on the consulting side, it's bringing into the awareness of everyone working in maternal and infant health and public health and preventative health, making sure that there's an awareness where the research is coming from, what is actually representative from a global human scale, and how can we respectfully integrate and honor lived experience, cultural wisdom in the solutions that are created for parents and babies. So it continues to shape everything I do, the work that I do, both at the community level and in supporting academic institutions, organizations, and startup brands that are working to bring better solutions to parents and families.
And before we close, is there anything else you'd like for listeners to reflect on or to take with them from this conversation?
I think really examining even the practices that you do in your own life, the care that you receive and seek out. I think it's beneficial for all of us to understand these biases in the science of care that has shaped everything we do. So another kind of more general example is talk therapy and uh, clinical psychology more generally, which is very much rooted in Western industrialized norms and biases. And so in this era where people are being encouraged to get mental health support, which is so wonderful, I think there's also a continued lack of inclusion of there's so many different ways that we as individuals can also care for ourselves and care for our own mental health and wellness. For everyone listening, I think it's always important that we think about the biases in what is, immediately accessible to us, and also recognize that there's so many different modalities for healing. There's so many different modalities for doing work and collaborating with people. And these defaults of talk therapy or these defaults of Western based medical care are not the only way. And so it's a benefit not only to the field as a whole if you're doing this work, but also to us as individuals to recognize that there's many ways to care for ourselves and many ways to seek out our own healing and support. I would say the most valuable thing that we can do is to get out of our bubble. And I've had a lot of privilege to be able to travel and live and work in many different countries around the world, which has shaped my perspective on this. But it could be as simple as going to a new neighborhood in your city, going to a new restaurant of a new type of food or new culture that that's not normally part of your everyday life. The more that we can intentionally put ourselves into spaces that are outside of our cultural bubble, the more our awareness can open to the breadth of human experience that exists. So that's an experiential takeaway I would absolutely recommend to everyone. And then for any researchers who are listening or anyone kind of in the scientific world, if you haven't read the 2010 paper by Joe Henrich and colleagues on the weirdest people in the world, talking about Western educated, industrialized, rich, and democratic people, and how all of our science is coming from that very unrepresentative sample. I would say that's absolutely relevant to all researchers to have in your back pocket to kind of remind us of where our participants are coming from, where our assumptions are coming from, and how we can work to produce and support a more inclusive and representative body of science.
Thank you for joining today's conversation with Dr. Emily Little. Until the next reflection, what might change if we stepped outside of our usual way of seeing?